Maddie Langston, and I'm going to do the medication administration checkoff video today. So here is my name badge, and then can you please scan the room? So the first thing I would want to do when doing medication administration is make sure I have no distractions or interruptions. So I will shut the door and I will turn off my phone so I'm not tempted to take any phone calls or make any phone calls. I will limit conversation with my colleagues, so unless it's about the medication I will be administrating, and I will follow my hospital's no interruption zone policy. So the next thing I'm going to do is compare my patient care order form to my MAR. So this is my patient care order form and this is my MAR. So the first thing I'm going to look at is the name. So it's Jaguar J. Jones, Jaguar J. Jones. The medical record number is 4176352, 4176352. He is allergic to penicillin, and I'll also see he's allergic to penicillin on the MAR. Now I will move to the medication I'll be using today. So I am using Novolin R regular insulin. Novolin R regular insulin. It is given at a dose of 10 units, and it's given at a dose of 10 units. It is subcutaneously, and it's given 30 minutes before meals and 30 minutes before meals. I know I'll be giving this drug to my patient if he is a diabetic or if there's complications in his blood sugar levels. So now I'm able to get rid of my patient care order form, and I will perform hand hygiene. So now I'm going to take a look at my vial, and the first thing I'm going to do is make sure it is still for Jaguar J. Jones, and so it is Novolin R regular insulin, and I'm also going to note the expiration date, which is 12/1/2025, which is still good to use. Now I'm going to look at the dose. So it's 10 units. This is a 100 unit vial, but I know that my syringe is measured in units, so I can pull back 10 units and be fine, but I will check with another nurse just to make sure my calculations are correct. It is given subcutaneously, and I know insulin is a medication that you are given in the subcutaneously injection sites, and then it's given 30 minutes before meals and is close to the 30-minute mark before Mr. Jones' next meal. Now, I will get an alcohol, because I know that this medication is given to my patient if he's a diabetic, and if there's problems in his blood sugar levels, and I know that and the documentation for this is all elements of a legal prescription are included. And now I'm going to show you my vial just to show you that I got the right drug. Okay, so now I'm going to get an alcohol wipe, and I'm going to open it, and I'm going to clean the top of my vial, and now I will dispose of this. I'm now going to take my syringe, which is a 1.5 milliliter insulin safety syringe, show it to y'all, and now I'm going to open it and take it out, and I'm going to take off the lid and sit it over to the side for a second, and I'm going to pull back 10 units of air. Whoops, it's kind of hard to see with that thing. Okay, and now I'm going to inject my needle to the vial, flip it upside down. Now I'm going to take a little bit more than 10 units and push it back in just in case there's any air bubbles or anything like that. I push the air to it. I forgot to say I did that before, but then I get 10 units in, and then get about 10 units, or exactly 10 units, not about, and then I'm going to take this off and check. Okay, now I'm going to show y'all. Might have to turn it a couple times. Okay, so now I'm going to put it on the safety, and I'm going to do the scoop method that we learned. Okay, so now I'm going to take my MAR, my syringe, and my vial. So this is for Jaguar J. Jones, and it is Novolin R regular insulin, and that is what I put into my syringe. Novolin R regular insulin is 10 units. So there's 100 units in my vial, but my syringe is is measured in units, so I'm able to pull back 10 units of medication, and it should be the same amount, and I will get a nurse to make sure my calculations are correct. It's given subcutaneously, so insulin is a medication that you inject subcutaneously injection sites, and my syringe is made for subcutaneously injection sites. And it's 30 minutes before meals, and so Mr. Jaguar J. Jones' next meal is in a little bit before 30 minutes, but I'm still preparing my drug. And now I know I would give this drug to him if he was a diabetic or if there was problems in his blood sugar levels. So now for documentation, I'm going to make a label. So I'm going to get a bigger piece of tape just because I do have big handwriting and my marker's kind of thick today. So I'm going to write the patient's name. So today is Jaguar J. Jones. And the medication is Novolin R regular insulin. And I'm going to put the units on here also, and or the dose, and it's 10 units. And now I'm going to show you my label. See, really big handwriting. So you can see that it does say Jaguar J. Jones, the name of his medication, which is Novolin R regular insulin, and the dose, which is 10 units. So now I will place this on my syringe, but in a spot where I'm still able to see the 10 units that I have into the syringe. So now that I have my label done and the documentation's done, I'm going to take my syringe, my vial, and my MAR to my patient's room. So we're going to come over here, and the first thing I do when I get into a patient's room is always do hand hygiene. So I will do that. And the next thing I'm going to do is identify my patient using two identifications. So I have my wristbands here, and I have my MAR here. So I'm going to do Jaguar J. Jones, and his medical record number is 4176352. 4176352. He is allergic to penicillin, and it's also said on his MAR he's allergic to penicillin. And I would ask Mr. Jones if he's allergic to any other, if he's allergic to anything else that I would need to make known for today's procedure. And now I will let Mr. Jones know that today I will be injecting him with insulin, and I checked his blood sugar levels, and he is all good to get it. And I'm going to be doing this in the subcutaneous site, which is in the abdominal injection site, which is about right here. And I'll be doing it at a 45 or 90 degree angle, depending on the amount of skin he has for me to pinch. So the next thing I'm going to do is, so now I'm going to do my last check. So I'm going to get my vial, my insulin, or my syringe, and my MAR. So I'm going to look. It is for Jaguar J. Jones, and it is Novolin R regular insulin. It says on my label that it's Novolin R regular insulin, and on my vial, Novolin R regular insulin. It is 10 units. I put 10 units into my syringe, and there's 100 units in my vial, but I know that the syringe is measured by units, and I was able to put 10 units, but I would get a nurse to check to make sure that is okay. And it's given subcutaneously. Insulin is a subcutaneously injected drug, and then my syringe is made for subcutaneously injection sites, and then it's given 30 minutes before meals, and it is now 30 minutes before Jaguar J. Jones' next meal. And I will be giving this to my patient because they might have diabetes or because their blood sugar levels are abnormal. And now I'm going to perform hand hygiene, and I'm going to put on my gloves. Ooh, kind of tricky. And then, well, before I put on my gloves, I would have raised the this bed to a comfortable working height, and I would have lowered the side rail, but I broke sterility there, so I would just note to do that before I would put on my gloves. And then I'm going to put on my goggles. And now I'm going to clean my injection site. So I'm going to do circular motions. And I'm going to place my alcohol pad in the location that I'm going to, and I do not assess any bruising on the skin that I'm going to be injecting. So now I'm going to take my syringe, and I'm going to take the lid off and put it in the sharps container. I'm going to pinch the skin, and because I'm only able to pinch 1 inch of skin, I'm going to do the injection at a 45-degree angle subcutaneously, but if I was able to pinch 2 inches of skin, it'd be 90 degrees angle. Since it is subcutaneous injection, you can do one or the other. So for this one, I'm going to inject at a 45-degree angle. I'm going to pinch the skin, and then I'm going to release the skin, and then I'm going to inject slowly. And then I'm going to pull out and apply pressure. I'm going to now dispose of my syringe in the sharps container. I will assess Mr. Jaguar Jones if there's any bruising, or not any, if there's any allergic reactions. And now I'm going to dispose of my alcohol pad and my gloves. Put this in the palm of this glove. And now I will document how that I did administrate the medication. I put it on my MAR, and I will also put how Mr. Jaguar Jones handled the thing. I will now lower the bed back to the lowest setting it will go and raise the side rail, and I will also put Mr. Jaguar Jones in a comfortable position, and I will come back in 30 minutes to check in on him and make sure that there was no allergic reactions or everything was running smoothly. And